Today, I'm pleased to welcome Dr. Patricia Lingley-Potty of the Strongest Families Institute. Dr. Lingley-Potty, please introduce yourself and tell us a little bit about Strongest Families Institute and the work that you're doing.
Sure. Thanks for having me, Craig. And people often ask me what the Strongest Family does. And I'm Dr. Patricia Lingley-Potty. I'm the co-founder, president, and CEO of the Strongest Families Institute and our Iris software platform. And really, the answer is quite simple. What we do, Strongest Families is a Canadian charity that really focuses on helping people of all ages improve mental health and well-being, really rediscovering hope and building their resilience by equipping them with our valuable, proven coping skills. We often see that these skills, really strengthen their resilience. And for 25 years, we've been helping children, youth, adults, families overcome anxiety, depression, behavioral challenges, deal with stress, everyday stressors, deal with substance use problems, even nighttime bedwetting, many other mental health concerns. And we do this by teaching people these skills that change their lives. And Craig, I'm not sure you probably are aware, but most of our programs are rooted in what we call cognitive behavioral approach. That's the gold standard for treating these types of conditions or symptoms at times. And our key ingredient is our coaches, our telephone support coaches. They are really the key to what we do.
So let me pause you there for a second. I want to go back. You said you started, co-founded Strongest Families 25 years ago. How have you seen the state of mental health and addiction, and how have you seen that evolve over 25 years, including that period of COVID, which seems to have had such a negative effect on the mental health and well-being of Canadians?
Absolutely. You know, it's interesting because 25 years later, I'm still having the same discussions that we were having 25 years ago about mental health and the incidence of mental health and wait lists and the lack of help. And this is despite all of our research and our proven program. But when you raise the issues about COVID, I just want to draw our attention to, COVID was tough on all of us. No age or person escapes the impacts of COVID, particularly our youth. And that's what I'm really worried about. If you have heard of it, there is a publication right now called The Generation of Risk at Risk, and that's put out by the Mental Health Research Canada organization. And that report really reminds us that our youth are facing unprecedented mental health challenges. This concerns me. They're our future generation. It's really a call to action. There's increases of anxiety, depression, suicidal ideation. And the thing that really concerns me is we know that there's programs that exist that work. We just need more targeted investments in what we know works. Strongest Families is an example. Millions of Canadian Institutes health research funding has, over the past 25 years, has gone into developing and proving that this model not only works, but it's life-changing, and we're still not equitable across Canada. And we're not alone. There's certainly other services that would be in the same situation. So, I am very concerned about the future of our youth. But again, if we really pay attention to this call to action and get our programs like ours and others to our youth and our families early, it can really make a difference now.
So let's stay with that timeline, and go back in time 25 years. What inspired you to get involved in the space to say, hey, there's a problem here, and I think that under your leadership with others, that you could make a positive difference. What was there a defining moment that sparked Strongest Families?
Well, yes, and this goes back to the founder, Dr. Patrick McGraw. We actually connected well beyond 25 years ago. I was in a field of infectious diseases and doing a lot of research. So a lot of my background is research and regulation. And when he received a large, it was like $2 million we received from Canadian Institutes of Health Research to build a new system of care, a system of care that would leverage the advantages of a new workforce because there's not enough specialists go around, but also was based on both, and really to target those areas that I mentioned that are the most prevalent problems. So I joined forces with Dr. McGraw back in the year 2000 because of my regulatory background, and we built we co-founded and built this system of care together.
Okay. So I'm actually very interested. You mentioned, cognitive behavioral approach, but
Mhm.
obviously, coming with a from a medical and a scientific background, you're taking more of an evidence-based approach and pushing the programs that are working and maybe evaluating new ones. How would you
Mhm.
describe kind of the evolution of that, or was that something that was baked in right at the beginning, always taking, what you know to be the best practices and reevaluating old ones? How do you deal with that today? Like, what does that look like?
So we approach everything the same way using best science, leveraging the advantages of technology because we own and operate our own proprietary software platform. So we and not only that, what makes us also unique is the co-design that I mentioned. We co-created not just one, but all of these programs. I think there was like a total of six back in the beginning that we had developed. We developed the training protocols. We had experts all over the world help design this system of care. Plus, people with lived and living experience, plus decision makers, policymakers. We actually have a publication on that called Integrated Knowledge Translation, and we use that same um, you know theory and background for everything that we do. Every program that we add, we start with making sure we build it with people for people because we need to get systems right by design. So in the very beginning, we did a needs assessment, right? We knew that when people did access care, um, there's large dropout rates. You can't continue often to take time off work every week for several weeks in a row, up to several months in a row. The cost of those incidentals for people. So we really took great caution in designing this system. We leverage a workforce of very highly capable monitored telephone coaches who follow our protocols. This is a very prescribed program, but it works so well. The coaches, people love their coach. A lot of my dissertation work was done on that because back, if you can imagine, in the year 2000, people were really skeptical. Trish, are you really going to get, a 6-year-old anxious child on the phone to talk to a stranger? At the time, we didn't know. That's why research is so important. So we needed to do the research. We needed to prove that this worked. We needed to prove that therapeutic alliance or those relationships were developed and they were strong because we know that that's a strong predictor of positive outcomes in the end. So to
So
go
let's
back to your question,
Yeah.
about, are we still doing similar, you know, things that we did back in the year 2000? We still follow those same guidelines of best science, co-design, testing, and validating what we do to make sure what we're designing works.
I don't, I do absolutely want to come back to the coaches, but you sort of opened the door there. Um, Pretend I know nothing about Strongest Families Institute, and we've met before, and I've certainly have heard your story before. Explain to somebody. So you talk about that 6-year-old anxious child. How do they even come to be aware that there is coaching available to them? Like, how does this work from the ground up?
Well, that's a really loaded question, Greg, because as I mentioned, we're not equitable across Canada. We have 13 provinces and territories that we try to work with. We have some provincial and territorial funding, but it's not equitable across Canada. Um, and so how this looks, it can look different in different regions. And so our website, strongestfamilies.com, would help guide that. We do have some national funding for our military veteran and RCMP division that's led by a military spouse. And this is actually quite easy. If we are available in the regions and or perhaps we have a donation, a gift from someone who says, here, use this money for those people who don't have access to your programs. So it could be a professional that refers a person. A person can call us outright and just ask, about our services and our availability. It might be a school counselor, it might be a teacher, it might be a daycare teacher. We really do try to, promote our services as best we can through webinars and social media and different avenues like that. But once a person connects with us, it's very quite simple. Our people are standing by on our end. It's a phone call away. We walk them through every process side by side. We stand by them through the whole journey.
So a big part of it sounds like the relationship that the people you're serving need to form with their coaches or the leaders that are running these sessions. How difficult is it for you to recruit and to train people who have the capacity to help in this way?
It's not difficult at all. And I know that you asked me about like a 6-year-old, and I do have an example that I'll share with you. But when it comes to um, recruiting coaches and training them, these are very highly capable people who care and care deeply and they're compassionate. It's not difficult for us at all to find folks who want to do this work. And training them, it doesn't take, because this is such a well-developed system of care, it doesn't take us long to do the training. And training is very intensive, but with the right person on the other end of the phone, who really wants to make a difference in people's lives, it only takes us several weeks to train up a coach to get them to where they need to be to help people.
Maybe I could just use that. Usually I sort of reserve this for the end, but let's segue into that right now. How can people help? Obviously, there's some financial support which could
Mm.
open up the services in different parts of the country, but there's obviously the opportunity to work with you in a coaching capacity. But you
Mhm.
mentioned awareness. How can
Mm.
somebody who's listening to this say, like, I don't know how to help, but where's the jumping in point for some folks?
Well, the way I see it, everybody who's listening today could make a difference. Whether it's a parent or a caregiver or a struggling adult in need, you can just really learn about our programs, go to our website, strongestfamilies.com, pick up the phone, call us, because if we can help, we will help, and we have no wait. It's a toll-free number, 1-866-470-7111. If you're a healthcare provider, I encourage you to refer now, refer early, because we know if we can catch problems early and intervene early, the outcomes are really strong and we can make a difference early. Um, and again, we have no wait. So, refer away. If it's a business, a government, or, a foundation who wants to partner with us, we love having partners and our stewardship is really good. Um, we really look for partners or donors that want to give the gift of good mental health to people of all ages. What else am I missing? A policymaker. Let's just say it's a policymaker listening from a region where we don't have funding necessarily. This is really an investment that is a good investment of public funds. Reach out to me and or my team, and I'd be happy to have a conversation and demonstrate what our programs look like.
You mentioned that, when you started Strongest Families, obviously you were taking your approach and bringing it forward, but um, there was obviously a gap in the care continuum, if you want to call it that way. Do you still see that gap? Is it narrowing? Is it getting wider? I mean, the challenges of today are different than 25 years ago. Where do you see yourself sitting in the ecosystem?
Yeah, it's very similar, but COVID has changed things. And so when I see where we sit in the ecosystem, we were designed as early intervention. We have a full system of stepped care that's available, high impact, low cost, because we are a charity. I see us as a very, very strong primary mental health care reform solution. Interesting, we have seen in a lot of we actually just finished doing analysis for Public Health Agency Canada for a project that we were doing together. And when we looked at the analysis of our outcomes, I'm deviating to some of our outcomes because I think this is really important about where we're positioning ourselves. We have shown with our impacts, our outcomes are actually equally as strong across all different populations and backgrounds and cultures, and as well as socioeconomic um, class or status, so to say. That is quite compelling. And so, what that tells me is the co-design that we take great care doing, people are resonating with the programs and they see themselves in the programs. And again, they love their coach. The coach is like their best friend, like
Right.
my sister. So to go back to where we see ourselves, again, I would love to be a household name. There is certainly more work to be done on the ground. We have the capacity to help more people. We help thousands and thousands of Canadians a year, but we want to do more.
Earlier you teased a story that might bring all of this into context. Can you maybe share a story, a real example of how you've helped and how the system works?
Yes. So, and this example is, you can actually look at Kirsten's story on our website. So Kirsten was a 13-year-old in very rural Newfoundland. She was struggling terribly, anxiety, depression, suicidal ideation. She just didn't want to live. Her parents were just distraught with not knowing what to do. Tried everything. Found our Defeat Anxiety program. Within weeks of using our skills every day, Kirsten's life started changing. So before the program, she was doing poorly at school, wasn't attending school, was being bullied. Our skills quickly equipped her with the confidence and the ability to control her anxiety and depression. She started thriving, went, going to school regularly, like regularly. Her grades increased, just life changing. Do you know what she's doing now? 3 years later, 16 years old, she's competing in national curling championships, something she would never have otherwise done without these coping strategies. These coping strategies are good for everybody, zero to seniors. And I think that just is one of thousands of stories. I think about an emerging adult in far remote northern Canada, and that's the other piece of this is we're reaching people anywhere they live. Doesn't matter where they live, and our coaches working all hours, day, evenings, nights. This person was struggling terribly with anxiety, depression, stress. Wasn't leaving her home, smoking a couple of packs of cigarettes a day. Just somebody else was paying her bills, and again, with our ICANN program, which is very similar to Defeat Anxiety, but slightly different, um, she within weeks started going to a cafe. She started getting out. And by the end of the program, she had quit smoking. It's not a smoking cessation program, but it's really a good demonstration of how this coping skills will help people overcome some of those things. We see a 50% reduction in substance use with our programs. And she got out and got a job, just really, really quite impactful. So a couple
So
of stories there for you.
yeah, I mean, I would say that underlines the why do you do what you do, in
Yes,
a big bold marker. You mentioned a couple of programs, and I want to give you a chance to maybe, other than the defeating anxiety program, what are the types of programs that you developed so that if someone who's listening, they may say, I
sure.
know somebody, or maybe themselves could benefit from some of these programs. It's sort of that catalyst to get people
Yes.
taking a second look at the work you're doing.
Yes. And one thing I didn't mention, we are completely bilingual. And we do have other accessibility options within Strongest Families. We help a lot of newcomers. So it's very, very equitable across multiple populations. Um, right. And so some of our programs, and I'm gonna name them because sometimes that is really beneficial. For our positive parenting programs, we have Parents Empowering Kids, but Parents Empowering Neurodiverse Kids is a specialty program for kids with autism or FASD. And those programs go from ages 3 all the way to 14, 15. We have multiple anxiety, depression, stress programs. So we have Chase Worries Away, that is for younger kids in around 5 to about 11, 12. Then our Defeat Anxiety takes over from there, 12 to about 17. And then our ICANN program is for 18 and above. So we cover all of the lifespan really there. We have a nighttime bedwetting program that's a urine alarm. I was a bedwetter when I was growing up, and full saturation every night until I was about 11-ish. my poor mom, did laundry every single day, and back then, there were no fancy pads to put down. So, my brother came along doing the same thing 6 years later. So this is a near and dear, program to me. We actually supply a urine alarm. We provide all materials, handbooks, videos, stickers, charts, you name it. We provide everything free of charge, along with our weekly 1-hour coaching. The last couple of programs are new. We just launched them in the fall because we needed to fill gaps. And that goes back to one of the other questions that you had about how are we continuing to fill gaps. We know that perinatal mental health prevalence is high, especially Newfoundland and Nova Scotia are one of the highest in Canada. And so we partnered with the Newfoundland government when I had sent a proposal through to say, why don't we take a combination of all of our skills from the parenting program, from our ICANN program, and put them into one 6-week program for 0 to 2, so for new parents. And it's just already been showing to have a huge positive impact, not on just the mental health of the parents, but the attachment with their children and the relationship development. The last one is something called classroom common care. And this is also going back to this positioning of where we kind of fit in the ecosystem. Because of our step care model, we are very much looking at a population mental health promotion and prevention approach. And that's where our classroom work comes in. We do virtual coaching once a week for 4 weeks. We are focused in some of the Indigenous communities in northern Saskatchewan with expansion plans across Canada. And so it's really that step care model focuses on population mental health promotion prevention, brief intervention for mild conditions that may not be impairing people, but also our highest level of intervention that was shown in clinical trials to overcome diagnosable pediatric mental health disorders. And that's very compelling. So again, that's where our proof and evidence comes from, and the fact that we have very strong outcomes. So I hope that gives a little overview. I don't think I missed anything.
Well, is it that's usually one of my questions. What did we miss? I think you've done a great job explaining kind of where you came from and the work that you're doing, and also letting people know about some of the programs. I do want to tie it all up with a little bit of a bow. Uh, you've got a website, you mentioned social media, you mentioned a phone number. Can you just repeat all of the ways that people can get in touch with you, get in contact with you, follow the work you're doing, maybe read some of the research reports that you've put out? Where is all that information found?
Well, that's great to know. We do have our website, strongestfamilies.com. Our toll-free number is 1-866-470-7111. We're on Facebook, so follow us, like us, share us on Facebook, LinkedIn, X, Instagram. Our research, my dissertation work is actually publicly available. It's got 5 of our publications in it that you can access just by Googling Dr. Patricia Lingley Potty, Dalhousie University. So my PhD publication would come up. People can reach out to me at ppotty@strongestfamilies.com. Um, those are the main ways to connect with us, really. And there's a donation page on our website that people can feel free to give gifts, or again, contact me at any time, and I'm happy to talk about any types of partnerships.
Well, thank you. Thank you so much for spending time with us today, and letting people know about the important work that you're doing, supporting not just the mental health of people in Atlantic Canada, but all across Canada, especially into our northern regions. Very great to hear from you, and I hope people check out the resources that you mentioned. Thank you very much.
Well, thank you, Craig.